This is the season of profs, so a video for the students who are appearing for their professional exam. This is the season of the final prof. So I am Dr. Mayukh Hazra. I got 6 honors in my MBBS, 2 gold medals in my MBBS and 1 in my PG. So 3 gold medals. I got a rank of AI at 29 NEET PG 2023 and currently I am a third year dermatology resident. See my trajectory during my MBBS. In first and second prof, there were 7 subjects. I got only 1 honors. After that, I implemented these all techniques which I am going to reveal you in this video. How to write your answer in the theory exam and how to present in the Viva exam. Then in the clinical subjects which are more difficult and which are more difficult to score, as you know, it is very much difficult to get honors in surgery or medicine. So in those subjects, in third and fourth prof, 7 subjects, I got 5 honors. And I assure you that this is the most detailed and informative video that how you should present in the Viva and theory exam to boost your rank up to a greater extent. Because I have seen all the videos on this topic and no one has mentioned these all points. And I assure you that if you implement these all techniques, you are going to boost your marks by 10 to 20% at least. Means if you are in a position that you are not able to get honors, you will surely get honors or distinction. Coming to theory exam, think like the examiner. In West Bengal, it is now digital evaluation. Other states, I think it is still on paper evaluation. So they check approximately 200 to 300 questions during the exam season gets over, and they get barely 40 to 100 rupees per paper. So what they will see, they won't read your story like answers. So they will read keywords, diagrams and flowcharts. They are searching for these things. If you provide them, your marks is going to boost by 10 to 20%. Coming to long answer template. If you are anatomy or in the first or second prof, you will have to give headings of definition, like you are writing a short note on cubital fossa. So you will have to give what is cubital fossa, not the exact definition, what you understand by your own concept. Write it in a single line, then give the heading of boundaries. You write the medial, lateral, roof, floor and all. Then you write the contents and what is the clinical significance of cubital fossa, because it gives space for the anastomosis, it helps in the movement. You write all the applied importance. You go for the venipuncture, you palpate the median nerve and all. For the final year or the clinical subjects, in long answer, you will have to write definition, classification. You can modify it according to the question. Etiology, pathogenesis, try to write in a flowchart. No need of long story like answers. Some clinical features, 1 or 2 investigation, management, complication and a relevant diagram. For short notes, definition, etiology, clinical features, complication, management and diagram. Okay, I will share this whole PDF in my Telegram channel. So if you are new to my channel, then do join my Telegram channel. The link is given in the description box below and pinned comment section. See, what do you understand by a flowchart? This is a flowchart come diagram. I am showing you the flowchart of type 1 hypersensitivity reaction. So at first, the antigen presenting cell, when the allergen is second time exposed, it presents to the T cell receptor of T helper cell. Then T helper 2 cell is activated by interleukin 4. Then it secretes interleukin 4 which produces IgE antibodies and IL-5 which activates the eosinophils. Now in the second time exposure, there is cross linking of the IgE in the Fc receptor of mast cell, and the mast cell releases histamine which causes vasodilation, bronchoconstriction, and by arachidonic acid pathway by LOX and COX it produces prostaglandins and leukotrienes which cause vasodilation and bronchoconstriction. After that, you will have to use multicolor. For heading, you use black color because it is much highlighted. The black color is more highlighted than the blue color. For main text, use blue color. For keywords, use brown or underline. Brown is a bit better color than the pink because pink is less highlighted. So brown is more highlighted than the blue. And never use green or red color because they are used for evaluation. So these two colors are strictly prohibited for using in the professional exams. Use tables as and when you can use for any difference. Use keywords. What I mean by keywords, don't use decreased urine output, use oliguria. Don't use increased urea creatinine, use azotemia. So the examiner will know that he has knowledge about the terms and definitions. Handwriting. See, I show you two pictures of the same room. Which is more aesthetic? You will say me that my hostel room looks like this. But will the examiner like it? Because examiner is not staying in the hostel room. So you will have to be aesthetic in your handwriting. It should be legible, neat and clean in the answer sheet. You have seen all the Apsara ad also, that extra marks for good handwriting. So yes, if your handwriting is good or if it is neat and clean and legible, then you are going to get extra marks because others are not writing in a legible handwriting. See, I changed my handwriting 3 times, so you can also change if it is not that much legible. I used to write in cursive handwriting. This was my signature and still my signature, but I changed to spaced normal handwriting, but it was tilted in the right side. Then I again changed it to not slanting, it in the straight orientation. So you can also change it if you have time. Now I give you an example of short note. So onychomycosis commonly comes as a short note in your medicine paper for the dermatology subspecialty. So definition, onychomycosis is fungal infection of nail unit. I have highlighted this infection of nail unit. I want this to go into the eyes of examiner and he will catch it that yes, fungal infection of nail unit. Then etiology, trichophyton, epidermophyton, Candida albicans, because this is a scientific name, so I have underlined it, and Aspergillus niger. Predisposing factor, diabetes mellitus, occlusive footwear, wet work, homemakers, immunosuppression. Now the clinical types, this you have to mention in your answer sheet, and if you give the diagram, you are going to get at least 4.5 out of 5. Distal, lateral subungual, proximal subungual, white superficial, and total dystrophic. Clinical features is nail discoloration, subungual hyperkeratosis, which is friable because if it is adherent, it is going more towards psoriasis. Onycholysis, thickened nails and brittle nails. Investigation is 10% KOH mount, and orally you can give terbinafine or itraconazole, and topically amrolfine nail lacquer. This completes your answer. Now join my WhatsApp or Telegram channel, because if you want Prof related material, I will give you materials regarding the orthopedics and all subjects which are related to the Prof. So it is going to help in your Prof. Coming to Viva and practical exams. Know your examiner. So some examiner have some few favorite topics. You need to know that. Some examiner likes representation in such a way that it is different from the other examiners. So you have to know it. From whom you can know it? From the seniors who have given before exam or the previous day who have given the exam. They can tell you. And in this case, don't be selfish. Always tell your friends that what kind of questions your examiner have asked to the next lot of people. And they are also going to tell you the same. And you are going to mutually benefit because you will have to pass this exam together. Okay, don't see it as a competition. You will have to pass it together. You have to get promoted to the next year, and also you will have to start the internship. Appearance also matters. You have to be neat and clean. You can go for clean shave. I didn't used to go for clean shave. I used to trim my mustache and I used to shave my beard. And you must use a clean and iron apron. Roll number should be visible on apron. Position with respect to the patient, be it physiology practical or be it the clinical subjects, you have to maintain the position, right or left side of the patient. Consent is a must, and Indian students, they forget to take the consent because we have such a huge patient load that it is not possible clinically and physiologically to take consent from each and every patient during the OPD. But it is a must, okay? And examiners will see you. you will have to explain the procedure. Then you will have to ask that I am going to perform this procedure. Like you are examining a gynae case or an obs case. So you are going to do the Leopold's maneuver or the fundal height you are going to estimate. So in that case, you will have to explain the patient that I am going to do this all procedures. Slight bit of pain can occur. If pain occurs, then do let me know. Completely empty your bladder, expose the abdomen. These all things you will have to do. And if you are examining a female patient's genitalia, then you will have to tell the sir or external that I need a female attendant while examining this patient. So these all little things, they matter a lot. Examiners know that clinical methods may be different, but these all things, these basics you are remembering or not, that is more important. Proper clinical method, because when you see tenderness, many students I have seen that they see tenderness and they ask that whether you are feeling pain, then tell me. But that is not the right way. You palpate the patient and you look at the eyes of the patient. If the patient is wincing, that means tenderness is present. You don't ask the patient to tell or complain when he or she is feeling pain. And exposure and bilaterality is a must for clinical exam, be it physiology or be it clinical subjects. You are percussing the chest, so second intercostal space in the right side, second intercostal space in the left side, then third intercostal space in the right side, third intercostal space in the left side. Like this, bilaterality should be maintained and you should expose the patient completely. When an examiner asks the questions, pause for 3 to 4 seconds, take time, structure your answer, then only present to the examiner. You all have seen UPSC toppers interviews. They also take a bit of time, 3 to 4 seconds, then only they answer, because they want to structure their answer. And speak loudly and confidently. This also matters a lot, because my one batchmate who had got the highest gold medals, 3 gold medals, it was not that she was very much excellent compared to others, but her vocational skills was very good. If she used to speak, the whole room was able to listen. So you will have to speak loudly and confidently, and you will have to maintain a eye level contact, not eye to eye contact. Near the eye level you will have to maintain the contact. And never guess blindly, because if you guess blindly, the examiner knows the right answer and he will understand that you are being over smart, and he will penalize you. He will take you in the wrong direction, and your whole Viva is going to go in that direction, and it is going to be a mess. So don't say I don't know. Say at this moment of time I am unable to recall. If you say this, then examiner will think at least he doesn't know the answer, but at least he is good in English. He has a good vocational skill. So use this, because in the UPSC interviews also you have seen that people say this. So those are the top kind of Viva exams. So follow them. Answer one by one. Answer a particular question, leave the rest for being asked in the future question. So by this you can keep the steering of the examiner in your hand, in which direction the questions will be asked. In Bengali, if I say যতই ঘুড়ি ওড়াও রাতে লাটাই তো আমার হাতে, I'm using it in this context that examiner can drive other students, but my exam is in my hand, the steering is in my hand. So I am giving you an example. My medicine exam short case was a case of ulcers in a patient of systemic sclerosis. The fingertip ulcers were present. Sir asked me that what you can see. If I at first said that these are digital tip ulcers which are commonly seen in systemic sclerosis, and the patient is also having skin thickening, so I am suspecting this is a case of systemic sclerosis, then the next question would be, what are the investigations you are going to do? Next question will be, what are the complications of systemic sclerosis? Next question will be, what is the leading cause of mortality of systemic sclerosis in this limited period of time? But at first, if I had said that I can see digital ulcers, then examiner's next question will be, what kind of ulcer this is? I will say arterial ulcer. Why you are saying this is an arterial ulcer? I will say this is has punched out edges it is occurring in the digital tips, no exudate is present, and healing with scarring. Then the examiner will ask that what all other findings you are able to see. I will say that there is skin thickening present, the orificial opening is being reduced, salt and pepper pigmentation is seen. Then the examiner will ask that what is your diagnosis then. My provisional diagnosis is systemic sclerosis and the Viva for the short case has ended, and I have given all the correct answers. But if you had given in the first question all the answers, then the examiner will go into more depth. So keep the steering in your hand. And practical vocational skills and confidence matters more. And obviously MBBS exam is a game of luck, because who is going to check your answer sheet, that completely depends on your luck. Other advices that I will recommend you to follow is have a good night's sleep, because it is a great stress buster. I used to sleep 7 hours every single day, because in that position, if new questions used to come, I was able to think it during the exam and I was able to apply it. Also take time for relaxation, talk to friends, play outdoor games, surround with positive people, not snakes, or else you will be demotivated at the end of the day. And if you are suffering from mental distress, or it is very much normal, because this is inhuman pressure, 11 subjects in 11 months, it is not possible to complete. So if you are facing some difficulty or your efficiency is being reduced, take professional help. Recently we lost another future doctor, so I don't want this to happen with you. It is not that much difficult to pass the exam, believe me, you will all pass the exam. Maybe not with flying colors, but with average marks you are surely going to pass the exam. And what matters in the MBBS is only passing. The marks doesn't matter in future. Your CV won't consist of your marks or anything, so don't overstress on this. The famous quote by Thomas Edison is, tomorrow is my exam, but I don't care, because a single sheet of paper can't decide my future. This is the take home point I want you all guys to take. So all the best for your professional exams, and share it with your friends who are going through the same phase, and so that they also can boost their preparation and marks during the professional exams.